Postnatal depression and baby blues are two common conditions that can affect new mothers and fathers after giving birth, but they differ in severity and duration and symptoms. Baby blues is a mild and short-lived condition that can affect up to 80% of new mothers, and it typically develops within a few days of giving birth and lasts up to 2 weeks. Some symptoms of baby blues can include mood swings, anxiety, irritability, sadness, and crying spells. They're usually mild and don't interfere with the mother's ability to care for herself or her baby. Postnatal depression, on the other hand, is more severe and lasts longer. It can develop within weeks or months after giving birth, and it affects around 10% of new mothers. It can last several months or even longer if left untreated. The symptoms of postnatal depression are similar to those of baby blues, but they're more intense and persistent. The symptoms can interfere with the mother's ability to look after herself and for her baby. They may include feelings of sadness, hopelessness, guilt, loss of interest in activities, changes in appetite and sleep patterns, and thoughts of self-harm or harming the baby. Postnatal depression is a treatable condition, and the approach can vary depending on the severity of symptoms and the individual's needs. The following are some options in which postnatal depression can be managed. Number 1, lifestyle changes. Regular exercise, eating a healthy diet, getting enough sleep, and reducing stress. Now, I recognise that the last two can be easier said than done with a new baby in tow. 2, support groups and talking. Friendship and family groups are often essential outlets for new mums, but for some, these might not be an option. So consider joining a support group for new mothers to help provide social help and alleviate those feelings of isolation and loneliness outside of the traditional emotional support network. 3, mindfulness techniques. Mindfulness-based therapies can help reduce symptoms of depression by promoting relaxation and self-awareness. 4, medication. Antidepressant medications may be prescribed to help relieve the symptoms of postnatal depression. Selective serotonin reuptake inhibitors, also known as SSRIs, are commonly prescribed for postnatal depression, and they're generally considered safe for breastfeeding mothers, though this should be discussed with your healthcare provider. 5, therapy. Cognitive behavioural therapy, CBT, is a talking therapy that helps mothers identify and change negative thought patterns and behaviours that contribute to depression. IPT is another type of therapy, interpersonal therapy, that can focus on improving relationships and social support. Remember that it is okay to ask for help and support when needed. You are not alone. It's essential for both you and your baby to seek help if you are experiencing any signs or symptoms of postnatal depression.